Hi, welcome to another episode of Natural Fertility with Dr. Jane. Of course, I'm Dr. Jane, and today I'm writing solo, and I'm going to take it back to the basics on how to track your cycle without losing your mind. There's a lot of information out there, and I want to just simplify and help you understand the importance of tracking your cycle and what it's going to do for you and what it's not going to do for you. And I'm going to go through what I call like a level step-by-step, what I would consider as a beginner versus advanced tracking and the pros and cons of each. So the main thing that I want you guys to get from this episode is that cycle tracking is a tool. It is not a solution. So what it does for us, it helps us understand where the imbalances are. So it creates a lot of awareness, but it is not going to fix anything on its own. You're going to understand what's going on with the cycle. You're going to see imbalances or early awareness about what might be happening. But if you don't implement anything to make changes, then the cycle isn't really going to change. And I've heard this, many of my mentors have said this. I'm sure you have heard this on the internet. I have been saying it now as well. But your menstrual cycle is your report card. So every month we have this report card that tells us how the previous month went and even how the previous 3 months have been. And I love the cycle tracking and awareness because there's different levels in terms of what it tells us and then what we can do and implement it to track that data as we're changing things. So really, really important for us to understand what's going on with the cycle. But I also don't want you to think that I have been tracking my cycle for so long and I'm still not pregnant. I'm glad that you're tracking your cycle. What is the data telling you and what are you doing to implement and change the data? Because it could be a castor oil pack, it could be your diet, it could be you're improving your sleep, your stress management, or in cases for myself, when I take on patients, I'm going to write a very specific protocol based on lab testing, and then we're going to continue to track the cycle so I can see the changes in the cycle based on everything that we have implemented. And there's, of course, some expectations of the cycle going, quote unquote, wonky because we're making certain changes and the body is resetting. And so there's things that are, quote unquote, normal and things that are abnormal when we are implementing a protocol. And I've had a couple of people reach out to me and say that, my cycle is terrible after I did this cleanse, or ever since I did X, my cycle hasn't restored, or ever since I had a miscarriage, my cycle is not the same. So I think it's really, really important to understand and track the right information, but also know that you might need deeper data, diagnostic data to tell us what's actually happening because it's a tool, it's not a solution. So let's go into level one. What I call level one, it's calendar tracking. And really, this is a foundation and everyone needs to start here. I think every woman, as soon as a teenage girl gets her period, she needs to start becoming aware of the length of her cycle. So you want to know how many days you're bleeding for, and then how many days is your total cycle. Is it 25 days, 26 days, 28 days, 34 days? The couple of nuances that I think are important to know is the bleeding days. You want to differentiate if it's heavy versus medium versus light. Is it spotting beforehand, afterhand? You want to understand those things. But day one is when you actually start bleeding, not spotting. The next thing to differentiate, if you will, is the day, how many days your cycle is. So if you started your cycle after 6 p.m., it is considered that you started the cycle the following day. If you started the cycle before 6 p.m., it is that day. So let me use an example. It's day 26 of your cycle, and you started spotting at 7 p.m. You have a 26-day cycle, and your period started on day 27, which marks it as day one, and the calendar starts. It's 26. The other example of this, the other version is day 26 of your cycle. You started spotting at 12 p.m. That is day one of your cycle, which means your cycle length was 25 days. As soon as you start spotting/bleeding, and so the other nuance there, if you started spotting and then you started bleeding shortly after versus it was just a little bit of spotting, and then the next day was a little bit of spotting, and then the next day was a little bit of spotting, and then you had a little bit of bleeding or you had the bleed, then it's day 26 is spotting, day 27 is spotting, day 28 is spotting, day 29 the cycle started. So you have a 28-day cycle, but you had 3 days of spotting before the cycle started. I think that a lot of women don't understand this, and I'll tell you kind of what's normal and what's not normal. The first step in this is you just want to understand your cycle and what's going on, and then preferably you're working with a practitioner like myself to help you understand this information so you can actually do something with it, because it is not normal to bleed for 7-10 days, heavily especially. Usually 1 to 2 days is good, but if it's more than 2 days, the woman usually is losing way too much blood. And I do have a whole other podcast in terms of like how much blood you should be losing. You shouldn't be losing more than 100 milliliters. And ideally it's below 80, like 60 to 80. And most women are losing way too much blood, which is why their ferritin and their iron levels are really low, and then B12, and they're depleted and all of this stuff. So you don't want to be bleeding too much, but you also need to bleed. I have women who are not bleeding and they think it's good, and it's actually an early sign of diminished ovarian reserve or premature ovarian insufficiency. So we want to track the volume of blood that we're losing, and it is not normal to spot before and to spot for a long period of time after. Those different things tells us whether it's low progesterone or some kind of mild chronic inflammation, infection. We want to understand what's happening with the hormones and what are the symptoms that are being caused by it. Okay, so the biggest thing that this will help with on the calendar is you're going to understand the number of days that you're bleeding. So you're going to start to be able to see your average. And then obviously you're going to be able to spot any irregularities. So if you have a 25-day cycle and then a 35-day cycle and then a 32-day cycle, usually plus or minus 2 or 3 even days in the variance of the cycle, I'm okay with. If it starts to vary more than 3 days, so 3, 5, like it's 26 and then 35 and then back to 29. Again, it kind of depends on how often that's doing, because one ovary might be ovulating a little bit earlier, one ovary might be ovulating a bit late. With cycle tracking, we need more information than just one cycle. Typically 3 cycles is the minimum that I want to see, but ideally more, because it's ovaries. I had Dr. Carrie Jones, I believe, said this. It's like your ovaries are sisters, but they're not twins. So they're just going to do different things. And I had women who ovulate right side, right side, right side, and then left side, right side, left side, right side, left side, left, 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 right. Like there isn't a right or wrong. The body kind of has this rhythm, and the goal is for us to learn and understand that rhythm. This typically does not tell us if you're ovulating or not. It does not tell us anything about equality, the phase, the strength of the luteal phase, so the second half of the cycle. It doesn't tell us any of those things. It literally just tells us, is your cycle regular and how many days are you bleeding? So are there any irregularities with the bleeding? So I think this is where, if you're thinking about starting to conceive, or if you're a teenager and you want to understand your cycle, you just need to start doing this. And this is what I plan to do with both of my girls. So it's like, you just need to know on the calendar. And then eventually, obviously, there's other things that we want to become aware of. The level 2 of cycle tracking is cycle charting. And this is going to bring a little bit more awareness around the flow, quantity, the blood quality, the symptoms that are associated with your period. And then it also will tell us about the white cervical fluid and the strength of ovulation. Now, it's not necessarily confirmed, because there's lots of women who will produce white cervical fluid, and a lot of it, because they have high estrogen levels, and it has nothing to do with ovulation. It's just they have a lot of vaginal secretions and cervical fluid secretions because of high estrogen levels, as opposed to because they're ovulating. And the way that works is the cervix has these crypts that are sensitive to estrogen, and they produce the white cervical fluid production. They produce the white cervical fluid in response to this really big peak in estrogen. But then the problem is when the estrogen is peaking multiple times, if you're, let's say, in perimenopausal phase and that estrogen is a little bit chaotic, or you might have PCOS, then you're going to get a little bit confused. But I do really like cycle charting. Again, I kind of consider it as a beginner level of awareness, but it now takes it a little bit deeper. But basically, you're doing the same thing as you're tracking the day that your cycle starts and when it stops, but now you're tracking secretions and you're tracking like really big symptoms. So day one, you'll mark it red, and then you kind of make a note. Is this a light day? Is this a heavy day? Is this a very light day? Is it spotting? Is it bright red? Is it brown spotting? Is there mucus? What is there clotting? So now we need a little bit more details on the days that you are bleeding. And every day at the end of the day, you have this chart on your table and you're essentially coloring either red, and I do green for white cervical fluid production, because those are usually the days to try to conceive if you are trying to conceive. But I want more details in terms of the quality and the quantity of the blood, the clots, and then the symptoms that you have. So if you have a lot of fatigue, if you have a lot of depression or anxiety, and even good things like, oh my God, I felt amazing on these days. Like my confidence was really great. My skin was glowing versus I had acne and breakouts and I wanted to hide. I want to know as much as I can on those details in the chart, because again, it allows me to understand the patterns of the hormones and how you are experiencing in your body. I think that's really important. Like you have to tie the symptom to the hormone fluctuation, so you have a little bit more grace with yourself instead of thinking that, oh my God, I'm nuts, or just blaming it on your period. Also, oh, it's just my PMS. Where in reality, there's other lingering things that we need to address. Digestion is a big thing to monitor as well. Sleep quality, that tends to decline, especially in the second half of the cycle, especially when you have lower progesterone levels. And then digestion you tend to get a little bit more constipated in that second half of the cycle if the liver and the bile isn't moving well. And then as soon as the period comes, you tend to get loose stools and diarrhea. And so it's important to understand that pattern, because it just tells us a little bit more about your liver function and bile flow and digestion and all of that stuff. So the pros, obviously, like it is still fairly simple. You do have to do it daily now, and you're going to get more insight. So this isn't just like it's 28 days and I bled for 5 days. Now you're getting deeper into understanding the quality of the blood, the consistency of that blood, the spotting, the patterns, and then of course the white cervical fluid production. And so the way that I teach it, when you're tracking white cervical fluid, you're expecting it in the middle of the cycle somewhere. And typically it can start as soon as that estrogen starts to peak and rise. That's when white cervical fluid production should start. And so if you have very little white cervical fluid production, I'm thinking about the strength of that ovulation. I'm also thinking about hydration, and I'm also thinking about like body awareness, because sometimes you as a woman just don't know what you're looking for if you're new to tracking your cycle. And even if you're not new to tracking your cycle, sometimes you don't really know what to look for. And so the white cervical fluid, it's that egg white consistency. It's really slippery. It's really, there should be an abundant amount of it, especially when you're young. As you get older, you're going to notice a decrease. So it's going to go from like 5-7 days of white cervical fluid production to, let's say, 3 to 5, and then eventually 2 to 3. And that very much tells us about the follicular development, the estrogen levels rising, the hydration levels, and then, of course, the body's ability to make that white cervical fluid. The tricky thing here is it can be a little bit confusing, because like when you go to urinate, you might lose some white cervical fluid production. So you might not even notice that. You might not notice it at all when you're wiping, but then in your underwear, you'll notice a little bit of crusting. And so you never really got to feel the slippery mucus that, we want it to be. And so sometimes that feels like, oh my God, I didn't make any white cervical fluid. The other pieces that I always get my women to track when you're noticing the white cervical fluid production or when you're supposed to, are you also noticing libido changes? And then there shouldn't be any dryness during sex. If there's dryness during sex, I'm very concerned about, like, there's no lubrication. Especially for a woman under the age of 40 and even 45, I am concerned about her estrogen levels, and I'm concerned about hormone health in general. And so there's all these fancy lubricants that are out there now because they are like, yeah, if it's painful during sex, just use a lubricant. In reality, that tells me much deeper issues. And those are the women that don't tend to produce a lot of white cervical fluid. And if you are that woman, then keep listening, and I'll tell you some of the other things that I would be looking at to confirm that observation. But it is not normal, especially so during the fertile phase, there should be no issues with lubrication. And if there are, then that's a big, big, big red flag for me as a naturopathic doctor and a natural fertility expert. There is obviously different, it's not, the white cervical fluid is not, there's that, and then there's the arousal fluid, and then there's just like other vaginal secretions that's not white cervical fluid, and it's not cervical production, that when the woman can get confusing. But in general, I want to see that slippery, that really like clear, uh, in lots of it, preferably halfway through the cycle. And there should be a day where it's peaking. So it's like, it's a little bit. And then one day you're like, wow, that's a lot. And then the next day it's like, oh, that's a little bit again. And those are usually can be mapped out with an estrogen curve as well. So I do like it. And the way that I kind of teach to make it simple is just to check on wiping. And yes, you're going to lose some when you're urinating. And yes, you're going to lose some in your underwear, but you should still notice some. And then when you wipe, you should feel and see that slippery kind of sensation on the toilet paper. And then that's how you know, versus like you having to dig into your vagina and look at your cervix and then try to pull out the white cervical fluid. There is absolutely those measurements. I just think that it's a little bit invasive to do that all the time. And I don't know if it's worth it, to be honest. I might change my mind on that, but right now I don't think so. The other component that I want you to be aware of, if you do have sex on a regular basis, then you're going to confuse that white cervical fluid with semen, because of course, semen does change the vaginal pH, but also will change the white cervical fluid in the way that it feels. And so my recommendation, when you're first starting to track and you really want to understand how much white cervical fluid production you have, is to actually avoid having sex for that 1 month. So then you could see it and feel it instead of getting confused with semen. The next level, and this is kind of level 3, if you will, and you don't necessarily have to do all of these, but the basal body temperature is the next thing. And this is when you take your temperature first thing in the morning. You need to use a 2-decimal thermometer. You need to test it every day at the same time. And then I basically usually chart it along the cycle data. And so as you can see that the compliance here can be a little bit lower because it's something that you have to do every day at the same time. And I do find that for most women, that's very difficult to accomplish because during the week or on the weekend, things change, or oops, I forgot this day. And so then it kind of starts to give us this incomplete data. But I do like using the basal body temperature because basically it confirms if you have ovulated in the levels of progesterone in the second half of the cycle. Now, it's not diagnostic data, meaning I can't see the level of progesterone that you have, but progesterone is a thermogenic hormone, which means it produces heat in the body, which means the body temperature will go up in the second half of the cycle. And you need to use the 2-decimal thermometer versus the 1-decimal because the fluctuations are not as big as we think they are. You know, there are a couple decimals. And so the more that we can track it, the more helpful it is. And I can't tell you how many of my patients who had PCOS who've done it, they were like, oh, I did the basal body temperature measurement, but it was just so confusing and the data didn't make any sense. And it's like the reason that the data didn't make sense is because their hormones were out of whack. They were wanting to see this beautiful chart the way that it should. So lower temperature in the first half of the cycle, higher temperature in the second half of the cycle. But that wasn't happening for them because they weren't ovulating. And so their temperature was all over the place. And what was dictating the temperature to be all over the place was more about the activity level that they had that day, or the stress level that they had that day, or what, like they went into the sauna, and that's what was dictating the temperature, as opposed to, or they got sick and there was an infection, as opposed to the hormones. And so, of course, that there's those aspects still anyways, but when you have a regular cycle and you're ovulating properly, you should still see a pattern, and maybe there is a couple of outliers, as opposed to the whole cycle is just like, none of this makes sense to me. So I really like it. I don't myself, I did it only for a little bit. I don't love it because it's just, I'll tell you the next one that I chose, and I like it much better. And then I don't have to measure my temperature, but I do have some patients who really love it. And I still love the data if you can do it well. So it is a great way to confirm that there is, ovulation happening and the temperature is rising, or if it's not rising, we'll also know that. The next one that I like, and it's not a true like menstrual cycle tracker, even though they are getting better, is the Oura Ring. And there's other wearables, of course, but I really like the Oura Ring because, and I'm not affiliated with it, I genuinely just like the product because it is low EMF. I keep mine on airplane mode, and it does the best work when you're sleeping, which is exactly what I want. I don't care about, there's like the Whoop and the Garmin and all of these. So the next one is the Oura Ring. Now, it's not a true tracking device. And of course, there's other ones like the Whoop and the Oura Ring and uh, Cycle Flow. Like there's a bunch of different devices now. The reason that I like the Oura Ring, and I'm not affiliated with them, I just genuinely love the device because it's low EMF. I keep it on airplane mode all the time. I just turn it on in the morning and I look at my data, and then I turn, it charges, and then I put it back on and turn it off. But what I like is it does track your cycle. So you can put in all of this data that I was talking about. I had a heavy day, a light day, there was clotting, there was no clotting, I had spotting, whatever. Like you can input all of that data. And then the ring senses your temperature, the rises and the falls. So I typically can tell when my period is coming based on that temperature tracker. And that's not true for everybody, because for some women, the temperature will only drop on like day 2 or 3 of the menstrual cycle. Whereas for me, sometimes the temperature will drop before I get my cycle, because signaling that the hormones have fallen, and then the cycle will follow. But what I like about the Oura Ring is it does most of its work at nighttime, which means it's tracking your heart rate variability, your quality of your sleep. And then now it is charting your stress patterns throughout the day. Although I do find that's valuable for some of my really high intensity people, CEOs that are having a hard time resting, where I just genuinely ask them, I'm like, how much are you spending in stressed and engaged and relaxed and we're restored? And it's like, oh, I'm 3 hours in stressed and like 0 restored, 3 hours in stress, 0 restored, and you're like, okay, so how do we start to get some of this restored time so the body is not running, on empty? And of course, you usually see the sleep quality decline, the HRV is not as good, heart rate is not as good. Of course, it's way less effort than BBT. I do like that it's digital and electronic. You're not going to lose this piece of paper, but and you can see that clear visualization of the cycle. Like you see when it's down, you can see when it's up, and it helps you adjust your training and your work and your stress based on the cycle phase. So you'll see that like, oh, I didn't sleep well because it's the second half of the cycle, and I can feel that things are not, and my temperature is not as high as it should be. So it gives you all of these, all of this information. The con is like, it's still not direct hormone data. So it gives you an idea, and it's better than the paper. And I do think it incorporates some of the basal body temperature. It's probably not as accurate as the basal body temperature, but that might change in the next couple of months or years. And it does pair with other apps like Natural Cycles and Flow and Clue and Fertility Friend. So there's a bunch of data integration that can happen. So bottom line is, I do really like it. It is not a diagnostic tool, but when I'm working with my patients and I'm tracking the data and I can see it, I can see if a protocol is working, if the body is like really pushing through something, or we can really start to catch on patterns with the menstrual cycle. And for myself, for example, when I first started progesterone, I can noticeably tell how much my body really liked that and how much it's changed my HRV and my heart rate dropped and all of this stuff. So I do really like it if you're going to pick one thing to track it. The next level is LH strips. Now, I've made a lot of content like you do not need to spend a bunch of money on LH strips. You do not need to be psychotic about it. And there's part of me that still knows and believes that's true. But I think that when we're getting very specific into understanding your fertile window and we want to time appropriately, we need to look at LH strips and understand when the surge is happening and how big the surge is. Because of that, I've seen LH surges that are really, really small, and women think like, oh, I'm ovulating because they're getting an LH surge, but they just get a positive or negative sign. That's not a good measurement for ovulation. It's like, oh, my LH is there, because you don't know how much LH it's picking up versus something that gives you, it should be over 25. It should be over 35. It's 80. Like one of my patients sent it and it was like 80. I'm like, oh my God, amazing. Like that's really good ovulation. Whereas my other patient's like, it's 0.5 and it's still saying it's a surge. It's like, that's not a surge. That's not a surge. You're not ovulating. So, I think the type of LH strips, and there's a couple ones out there. To be honest, I've been using Vivu strips, and they're okay. They do the TNC ratio. They don't do the numeric. And then there's the ones that I will talk about in a second. It's not just LH strips because it gives you a whole picture. So I do think that there's a time and place for the LH, and it's definitely for you if you have been struggling with infertility for a while and you are trying to figure out your hormones. What I don't do with my patients, and I don't recommend that you do this either, is when they start, my patients start with me and with all of us, in my practice, we look at a bunch of data. And then I'll take a break and go, I don't need to know this because I kind of understand what the body is doing and I don't want you to keep feeling overwhelmed. Let's work on this and then we'll start tracking again 3 months from now. And I will encourage women to stop tracking. If you've tracked for 3-6 months and you have a good idea of what's going on, unless you're working on it to improve, you can stop tracking. Remember that the point of tracking is to bring awareness and to help manage your treatment. So you're using the data to optimize your treatment. If you're just tracking constantly and you're not doing anything to change it, or you are doing things to change it, but it's not changing the data, you're doing the wrong things. This is why the data is important, is because it can guide us to what our treatment should be. But if it's not improving, then we're missing something. And LH strips alone is not enough. And even cycle tracking alone is not enough. This is what allows us to identify the problem. So then we can reveal the red flags, the real issues with diagnostic testing. And then we continue to track our cycle so we can see how the changes that we have made, the supplements that we started to take, how it's changing our bodies. Okay, so I think that's really, really important. I do find that the LH strips are inexpensive and, they will track your ovulation. I just want a numeric value. I don't want a plus or a minus. I want to understand a numeric value, because if it's under 25 versus it's over 25, that tells me the quality of that ovulation, and that should tell you the quality of the ovulation as well. And like I said, with my patient, she just got the hormone monitoring device. So Inedo is the one that I have recommended. And she was getting LH surges on her positive, but like the Inedo was like at 0.5. It's like, that's not a surge. It needs to be over 20 ideally. So we've, identified a really big issue. So the last level of monitoring is getting the hormone monitoring device. And I do realize that it's expensive, and I actually ordered one for myself as well, because I think the more I see patients using it, the more I'm like, okay, let me figure out. I always need to try it on myself so I can, guide my patients more. But I think that this is not just for fertility. This is something that I'm doing with my ladies who are in perimenopause. I have a couple of patients who are in perimenopause who do not want to conceive and they just want to optimize their hormones. You still need to do the blood work, Okay, so I always test, I always do diagnostics, but what the monitoring devices do is they take away the need to have to test your blood all the time because you can see how the body's progressing, and then you can change and adjust dosages of hormone replacement therapy based on what you're seeing on these devices. And of course, I like to see the long-term data. So one of my patients who has endometriosis, she just had a miscarriage, then she had her endometriosis surgery, and then we started tracking Aneto again because there was no point of tracking it before that. And basically, that first cycle post-surgery, she was just, her estrogen is high, like nothing is happening. It's just estrogen fluctuating. And of course, she's breaking out. She doesn't feel great. Her cycle is still regular, still showing up on 28 days, but estrogen is all over the place. So I'm like, we need to start introducing the progesterone. We introduced the progesterone the following cycle. And what you could see is that estrogen rose, it came, and then it started to try to do this like wonky thing. But because we introduced progesterone right after ovulation, her estrogen calm down. And you could see it. It tried to do it. It was like it did another one of these little bumps, but then it calmed down instead of doing 3 or 4. And she felt better because she could sleep now and she didn't feel as irritated. And then the next cycle, you could see that that estrogen went up and then it just, the curve. So this is what I would say is like a really quick response. And of course, we've already done a bunch of work, but it's beautiful to see that in 3 months, you could see that progression. I'll have women track their cycle, do absolutely nothing, and then go, why is my cycle not normal? My cycle has not been normal since I've done this. And and it's like, are you consistent with your diet? Have you started this protocol? Have you done this? No, my sleep has been bad. I'm not eating as well. I haven't had time to take my supplements. Your cycle is not going to change. Tracking your cycle is a tool. That's it. If you do not make any changes, your cycle is not going to change. Or if you only have negative changes, like you are more stressed or you're not eating as regularly or you're not sleeping as well, you are absolutely going to notice this in your cycle. So when my women are like, my cycle is terrible, I'm like, what did you do last month? What has happened in the last 3 months? Because if you had a lot of stress, you'll see how much it actually impacts your cycle and how important it is for us to become in tune and aware so we can start taking care of ourselves around our cycle instead of just doing, I mean, we're not doing whatever we want for no reason. We're just doing that because we don't have the awareness. We don't know what our body is telling us. And then we're trying to regulate ourselves, and whether that's through food or through shopping or through whatever. So then I feel better because I feel so dysregulated. So I really do. I am going to put the link to Aneto down below in case you are curious to try it out. And like I said, I have been using it in practice for the last 6 months. Like I have had certain patients where I'm like, let's just get it. Let's do it. What I do in my practice is, can I get you pregnant? And then can I get you pregnant faster is basically the questions without compromising the result. And we ideally, we get people pregnant within 6 to 9 months. There's couples for sure who take 12 months, and then there's couples for sure that take 2 years. And it very much depends on what is the reason that they can't get pregnant. So if you have a lot of lead in the body or mercury, or you have a lot of infections, your immune system has been dysregulated for years, we're not going to be able to get you pregnant in 6 months. I think it's unrealistic. But what I do find is I have a couple new couples that I have taken on that if I set them up and say, here's all the data that we're going to track and here's the expectations and this is how often we're going to retest blood work or we're going to retest the stool analysis or we're going to do this, then we can actually move that needle a lot faster. So one of my couples, it's like she's 40, she's in perimenopause, like we're catching her in this phase where the hormones are about to shut off and we're going to see if we can turn it on. And this is just like the second cycle that she's tracking, and we barely just started the protocol. I can already tell that her hormone profile is much better. And so it's exciting to see what we can do in the next 6 months. So when I see this data, the way that you want to be using that data is pivoting the protocols and what you're doing versus looking at the data and freaking out. When we understand what's happening, that's the whole thing. It's like, oh, this is what's happening. And then here's how I fix it. As opposed to, oh my God, my data is terrible. and I'm just going to keep tracking it. And oh my God, my data is terrible. This is how you get into like chaos and anxiety and feeling overwhelmed, as opposed to who is helping you read this data and what are you doing with this information. So I wanted to record this podcast because I think there's a lot of youth who are not really truly understanding how to track your cycle or what to do with that data. And I want to lay it out. And it's like, here's where I would start. And if you've already like, yep, done it, take me to this piece, then get the device, or get the Aura Ring, start looking at it deeper and look at this data that's providing you feedback daily. It's like a continuous glucose monitor. If you test your HbA1c, which is a marker of blood glucose for the last, blood glucose fluctuations for the last 3 months, if you retest that every 3 months, that feedback is too slow. Oh, it was 5.61 months and now it's 5.5. Oh, it's back to 5.6. Like it's too slow. If I put the continuous glucose monitor on you and you could see that it spikes every time I eat this fruit, you're going to stop eating that fruit. And then all of a sudden, oh, look, my HbA1c improved. So I look at these like the Aura Ring or the hormone monitoring device is something that gives us very quick feedback. And then when I'm introducing HRT, so for my patients who are over 40, they need progesterone. Some of them need estrogen. So that I can track and look at it and go, here's when you're going to need estrogen and you're going to do it for 5 days and we're going to track that data and we're going to see how high it goes. Then you're going to stop estrogen. We're going to introduce progesterone. And then we might still introduce a little bit of estrogen because we're just trying to mimic her cycle. And then obviously reestablish good follicular development and ovarian function and all of that stuff and optimize the environment. So there's a lot of value in these. I think if you're in the place where you're like, I just need some more clarity about what's going on, then I highly recommend you get one of these devices, track it for 3 months. And then if you're like, I need some help, then please reach out, fill out a form down below the application form to see if we can help. Because if we can't, we'll show you what that looks like. And if we can't, we'll make sure to point you in the right direction. But I just do not want you to suffer and struggle unnecessarily, hoping that one day the cycle is just going to regulate itself or, that you will get pregnant. I think we need to take matters into our own hands, especially in our day and age. And especially if you're over 35, like you just don't have time to wait for somebody to tell you what to do. It's like you just have to, here's who I'm looking for. This is what I need. This is the data that I've collected. Then, a lot more people can help. So thank you for being here. I hope you guys found this helpful. And if you are interested in working with us, please fill out an application form and we'll get back to you. Thanks again. And I'll see you next week.